There are two main muscles for hip abduction, the gluteus medius and gluteus minimus. The gluteus medius is the main hip abductor. Both muscles are innervated by the superior gluteal nerve. The function of the gluteus medius and minimus muscles is hip abduction, and this function can become compromised due to injury of the superior gluteal nerve. Involvement of the abductor muscle can also occur from injury to L5 nerve root or due to avulsion of these muscles. Avulsion of the tendon of the gluteus medius and minimus can occur at its insertion into the greater trochanter of the femur. This also will lead to muscle weakness and loss of hip abduction. Function of the abductor muscles is to keep the pelvis level during single stance, means when the patient is standing on one leg. When you stand in both legs, each leg will carry half of the body weight. When you have single leg stance, that supporting leg takes the entire load. If the hip abductors connected to the supporting leg, the leg touching the ground, are intact, the pelvis will remain level and the trunk will not lean. If the abductor muscles of the supporting leg are injured or affected, then the patient will show the Trendelenburg sign. In this example, let us assume that the right side hip abductor muscles are tested. When checking the integrity of the right side hip abductor muscles, stand behind the patient and ask the patient to stand in one leg. If the hip abductors connected to the supporting leg, the leg touching the ground, are intact, the pelvis will remain level and the trunk will not lean. With normal hip abductors, the muscles will contract and the pelvis become level. If the abductor muscles of the supporting leg are injured, the patient will show the Trendelenburg sign. As the patient stands on the side of the affected hip abductors, the pelvis on the normal side will tilt or escape downwards, and the trunk will lean towards the affected side. The weight of the unsupported leg and the gravity will tilt the pelvis away from the normal side to drop the pelvis downwards away from the affected side. Since the muscles are weak, tilt of the pelvis cannot be corrected, and this will throw the center of gravity off. At that point, either the patient will lose their balance or they will ask the trunk for help.